Hello and welcome to the University of Plymouth. This short presentation will give you an overview of our child health nursing programmes that we offer at the university. My name is Anna Chick and I'm the admissions tutor for the child health nursing programme. We offer a wide range of courses at the University of Plymouth, and those lead to professional nursing qualifications that can all be registered with the Nursing Midwifery Council. We are incredibly proud of the courses that we offer, and this next slide will show you the different courses which I will go through in turn. We offer a 3-year BSc undergraduate nursing programme in child health, mental health and adult health. We also offer a degree apprenticeship route. This is a traditional undergraduate BSc programme, but you are employed while you complete this route. Your employer pays your fees and also pays you a wage while you're studying with us. One of our newer courses last year was an MNurs. That means a Masters of Nursing. These are 4-year programmes which enable you to get a dual qualification in any of our 3 fields of nursing. For example, you are able to do a 4-year degree in adult health combined with child health combined with mental health, or mental health combined with adult health. These courses are 4 years long in duration and are completed at level 7, which is master's level. One of the other programmes that we offer is an MSc in nursing, which is 2 years in length. This can also be studied with adult, child or mental health nursing, and it is for those applicants who already have an existing honours degree. That honours degree can be in any discipline. For example, if you have a degree in arts, you are able to apply. If you have a degree in engineering, you would be eligible to apply. The other condition that we have with the MSc is that you are able to show us that you have some experience in healthcare practice. So we would require you to come in with 750 clinical hours. That means that you would be currently working as a healthcare professional, either in a healthcare assistant role in the acute or community area. If you have any more questions about that, it's very easy for our admissions team to be able to find out for you whether your current work role and your qualifications are appropriate. All of these qualifications give you the ability to be able to register with the Nursing and Midwifery Council, who are the NMC. The NMC are also the body who have validated all of our nursing courses. We have a number of aims at the university, and these aims are incredibly important to us, and we make sure that these aims are threaded throughout all of our nursing programmes here at the university. Our first aim is to produce safe, competent, confident practitioners. We want you to be the healthcare professionals of the future. We want you to lead practice. We want you to take healthcare into a new dimension, into a new domain, making sure that your patients are at the centre of your care all of the time. We also want you to be accountable and we want you to be autonomous. We want you to understand in full about healthcare practice, how healthcare practice works, and how you as professionals are part of it. We want you to be able to understand the decisions that are made about your patients and families that come into your care, but we also want you to be able to question that care and those decisions that are made so that your patients stay at the centre of everything. As we are a university, we want you to become acutely research aware. We want you to understand that there is an evidence base to everything that you do in healthcare practice, and we will help you and enable you to find that research, but also to be part of your own research so that you're taking practice forward all of the time. One very important part and aim for us as well is that you are non-judgmental and anti-discriminatory. When you work in healthcare, you come across all different types of people at all different times of their lives. They might be at the beginning of their lives or they might be at the end of their lives. You will also come across people who have different ethnicity. They are very diverse, different genders, different families, different religions and different understanding of how the world works. What we want you to be is non-judgmental and anti-discriminatory. So it's very clear that you have to be quite confident in your own self, but we teach you that as well, that self-awareness, so that you're able to nurse effectively. When you come to the university, our courses are 50% practice and 50% theory. That means that you are spending equal amounts of time in both of those areas. When you come into theory, you're spending time at the university campus. We have 3 campuses at the university which teach nursing. The first campus, our main campus, is in Plymouth, and that is on the Drake Circus site. That site teaches child nursing, adult nursing, and mental health nursing. It also teaches the MNurs and the MSc programs. We also have a base down in Truro at the Knowledge Spa at the Royal Cornwall Hospital. And this School of Nursing teaches adult nursing and mental health nursing. You are also able to study the MNurs program there as well. Our final site is up in Exeter. It's on the West site on Topsham Road. This School of Nursing also teaches adult nursing and mental health nursing, and it also teaches the MNurs program. If you are in theory, you will be based in one of those areas. As we're talking about child nursing here, child nursing is solely based on the Plymouth University campus. This is because it is a smaller cohort of students, but you will have the same experiences as all of the other students on campus. Once you start with us at the university, we always start you with a block of theory. That means that you'll be attending lectures, seminars, and potentially some online learning as well. Once you finish that theory, you then go out into practice placements, and I'll talk a little bit about those later on in this presentation. But your practice forms 50%. That means that you will be out with our currently registered healthcare professionals who work with children and families. And this might be in the acute area, or it might be in the community area. Just very quickly, I'd like to go over the modules that you'll be studying as part of your theory practice. So this is year 1. Year 1 is about foundation skills. An important point to note is that everyone is welcome in child health nursing. It doesn't matter if you've got lots of experience or no experience in nursing at all. Everyone starts at the same level. You will see on the right hand side that these are your modules written in black. So the first one you will do is about being an accountable professional. This module teaches you a little bit about what it's like to be a nurse now in our current climate. It talks to you about the history of nursing and where nursing is going in the future. You will then complete modules about communication. Communication is absolutely vital to nursing practice. It forms the basis of every single thing that we do. So we will talk to you about how you communicate with families, with young babies, with toddlers, with school-age children, and also going up to adolescents as well. The modules then continue in year 1, thinking about planning care and thinking about biology. We also have clinical skills modules that run all the way through our nursing courses. These clinical skills modules give you a chance to have a go at things. They give you a chance to practice putting things together, doing observations on your patients, drawing up medications, and completing those kind of practical tasks which you'll be doing in the practice area. Alongside the theory component, as I said in year 1, are practice elements. These elements of practice come in 2 slots of 8 weeks in year 1. You will go into an acute area where they care for children and families, either as little ones or up to young people, or you might go out into the community and go out with some of our health visiting teams or our public health nurses. You will also have the opportunity to have some cross-field experience in year 1 as well. That means that if you are a child health nursing student, you'll be able to go and experience something in the adult areas and something in the mental health area as well. It's really important for us at the university that although you'll be becoming qualified as child health nurses, that you understand the lifespan, that you understand that you are caring for an entire person who might be part of a bigger extended family. Year 2 takes your modules into developing more skills. So you've had a foundation in year 1, and year 2 takes you into the development of the skills that you've started to learn in year 1 through your practice. We think about applied pathophysiology, the disease process. So what can go wrong for our patients? Why do they become unwell? We talk about disease trajectories. We also talk about promoting health and preventing ill health. And this is vitally important as healthcare professionals. We're not only caring for the sick, but we're giving them the tools to be able to go forward and have a healthy life. We think about complexity. We think about those groups of patients that have lots of complex health needs, those patients that have long-term conditions and also might be coming to the end of their lives as well. We also start to think about research, evidence-based practice, and about how you can start to develop this into your own practice and your own practice areas. So again, these are in black are your theory modules that you'll do in year 2, but you will also have 2 placements in year 2. Again, one will be in the acute setting, in a hospital environment, and the other one might be in a practice environment in the community. For example, a special school or a children's behavioural unit or a children's hospice area. The last part of year 2 is about you having an optional placement. What we really pride ourselves on is that we allow our students to branch out, to have a real understanding of where they want to go, to do something completely different. And when you come to university, this is the perfect time to do it. So you will have an option of doing a placement either at home, in another area of the UK, or abroad. Moving on to year 3, this is really about competence. It's about you becoming competent healthcare professionals and almost tying up all of those loose ends. Again, you will have on the right hand side some modules that you'll have, and all of these modules will be at level 6, which is looking at degree level. You will have some field specific modules in year 3, and these are looking specifically at the critically unwell child and young person. They're also looking at the public health and promoting health of children specifically and families. You will have another clinical skills module. You'll think about management and leadership and how you are going to become healthcare professionals of the future. Research comes into this year 3 as well. It's very prominent in year 3. And you will also start to think about that transition into professional practice. What does it mean to be a student nurse? And then what does it mean to actually become a staff nurse, a registered health professional? Your placements in year 3 will become longer. And your placements in year 3 will start to think about children and families who require more care. So you might have placements in the neonatal intensive care unit, children's high dependency areas, the emergency department as well. We have lots of support available for you at university. We can realise that it can be quite a daunting time, particularly if you've moved away from home and you're coming to a brand new area, to a brand new city. But we pride ourselves on being able to support you through it. As we are quite a small course, we as lecturers get to know our students really well. You will be allocated a personal tutor, and that personal tutor looks after your pastoral care. You have that same personal tutor for the 3-year duration that you are part of the university. We also have lots of university support. We have a fantastic counselling service. We have a lot of mental health support as well. We have a learning and development team who are there to help you with your essays, with your assignments, with your poster presentations, and with your seminars. Our chaplaincy team are also always around to offer a listening ear. When you go into practice, when you go into an acute placement area, you will be allocated an assessor supervisor. That person will be a registered healthcare professional and they will guide you through the particular area that you're working in, but they'll enable you to do tasks, to question, to get the best from your practice placements. You will also have a link lecturer while you're out in placement. That will be a member of the university team. Could be because you will have paperwork to fill in. You will have an assessment to do while you're in practice. One of the things that we're very proud of at the University of Plymouth is our PALS system. It's a peer-assisted learning support. And this is where you will be mentored and looked after by existing students on the programme. If you are a first year student, the best person that you can ask questions to or learn from are students in the second year, because they are going through exactly what you're going through. So our peer-assisted learning support is available for all. If we think about when the student is in the middle of all that support, there is a wide range of different areas that you'll be able to access here. Thinking about placement opportunities, as we touched on before, these are the different areas that you will have access to. So anywhere that children are cared for in the community or the acute setting, you will have access to as a student nurse with us. We have a wide breadth of placement opportunities, and this is why our courses are so fantastic. They offer you everything that you would need in all the different areas where children can be cared for. We're also opening up new placement areas all the time. So if there is a placement area or a particular area that you'd like to go to, please come and let us know. Everyone does the same amount of placements when they come to the university, regardless of your background or the area that you've worked in before. Everyone has to have experience in primary healthcare, which is health visiting, school nursing, out in the community, children's community nurses, and in the acute areas, which are children's wards, day case units, neonatal intensive care units, theatres, emergency departments. We have many different NHS trusts who support our placement opportunities and look forward to taking our students at the University of Plymouth. They look forward to looking after you in practice so that you can become part of potentially their workforce. We have a wide range of placement areas that we offer at the University of Plymouth, and that means that we are able to give you as much scope as you would like to. We will ask you when you come for interview with us where you would like to be placed. This map gives you an example of where you could potentially go, but this is not an exhaustive list of placements. What we would like for you to do is to give us 3 preference areas. But when you come to think about where you would like to be placed, remember where you are going to be while you are studying with us. Are you going to be at home or are you going to be on the university campus? We will expect you to travel to a different area. So although you might have chosen to stay in Plymouth for your first placement, we will expect you within the 3 years to travel out to Torbay or to Exeter. When you're thinking about applying to us, there are a number of things that we look for. The most important thing to know is that we look at your total application when we are considering you for interview. We like you to have 5 GCSEs at grade 4 or above, or grade C for the old system, and these must include English, Maths and a Science. For our BSc undergraduate programmes, we have UCAS tariff points attached to them. These tariff points that you need are between 104 and 120. If you are unsure about how many tariff points you have, UCAS have a great calculator which you can find online. We give preference to science and human sciences and study within the last 5 years. Ideally, that study should be at level 3 or above. For our master's programmes, we have a higher UCAS tariff, and the reason for this is that you are studying at level 7. We like you to have 128 tariff points before you can access our MNERS programme. Sometimes our applicants are seeing the dual application, but actually the MNERS programme is a very intense academic programme and you must have the academic profile to access it. For our MSc programme, as I mentioned before, this is a 2-year shortened programme. You must have an existing degree, a BSc or a BA at a 2.2 or above. We also like you to have these 750 clinical hours, and these have to be in clinical nursing practice. Please speak to our admissions team if you're concerned about how these hours might look for you. We also accept BTECs. We give preference to science or a health-related topic, and we also accept access to higher education as well, but we give preference to distinction level. We also take applicants from those returning to education, but you must have had that study within the last 5 years before you come to us. If you are successful from your application form, we will ask you to attend an interview day on campus. And there we will go through a bit more in depth about the course, and we will ask you individual questions about our courses. You will have a one-to-one interview. When you're writing your personal statement, there are certain things that we do look for. We like to see that you have an interest and knowledge in child health nursing, the field that you're applying for. Any evidence of related work or voluntary experience is really vital, and we would like that experience to be directly connected to children and young people. If you can also think about communication skills. Communication skills are vital in nursing practice, so if you can give us some evidence of that in your personal statement, this would be good. We like to know if you understand about caring for others and about what empathy looks like, so try to include that in your statement somewhere. Problem solving and use of initiative is also very important, and we may discuss those things with you at interview. You could also put something in that shows your dedication or something you have excelled in. We'd like you to complete 2 references before you come to the university. These references are very important, and we do follow up all references that we get from applicants. We like your referee to send in a reference on our own university pro forma. We like your reference to have include something about your ability to work independently and in groups. And we like a reference about your character, and also a work reference as well is very important. Your referee could also write about your willingness to learn and your ability to complete the programme. And one of the most important things is that they actually support your application to nursing. If you are offered a place to study with us, we want you to be 100% sure about making the commitment to coming to nursing programmes. The course is extremely busy, and you have to be ready to give us 100% commitment. We are incredibly passionate children's nurses who lead the teaching team here, and we like to give you 100% commitment and also get that commitment back. We do finance an enhanced DBS check, which you will have to have done before you come to the university, and we also have to give you an occupational health screen. Please don't be concerned if you do have a long-term condition or you're worried about your health at all. We will help you to get the best from your practice while you're here. There are so many reasons why we want you to choose us at the University of Plymouth, and many of these reasons are written here. We have excellent student results, and our students are really valued as partners here at the university. The student voice is big. We always ask our students about our courses, and they help us to create them. There's a great opportunity for dual field nursing in mental health, child health or adult health. And again, we have a choice of programmes from undergraduate to postgraduate, looking at BSc Honours and Masters programmes. We have national awards here at the university, which we're incredibly proud of, looking at sustainability and also PALS. We like to innovate here. There are many different learning opportunities that you will experience, whether these are online or face-to-face. We always lead our teaching with research. We have research at the forefront of everything that we do. We have digital learning platforms that we collaborate with the We Learn community, with the We Nursing community. And these support your knowledge and give you the online information that you will need to go forward as healthcare professionals. We think about wider patient engagement. We look at the patient as a whole, their family members and also their extended family. We have lots of links internationally and also nationally to programmes of care that are going on. And our campuses are absolutely fantastic and in great locations. Lastly, I would like you to thank you for listening to this presentation today, and also to give you a little bit of inspiration. These are the amazing children's nurses who qualified last year. They are now all working in practice We have 100% employability here for child health nursing at the university, and I'm incredibly proud of all of them. Thank you.